I'm Jerry Willis.
I'm Steve Ducey.
I'm Shannon Bream, and this is the Fox News Rundown.
Wednesday, April 15th, 2020. I'm Jessica Rosenthal. States are talking about reopening their economies to a certain extent, but it's far from clear when.
I think the best approach is going to be focusing on the data, not on the date, and setting criteria for gradually and safely reopening.
I'm Dave Anthony. Since most of us are stuck at home, airports are like ghost towns. Planes are nearly empty.
One airline says they're losing $100 million a day. So either we get up out of our caves and start to bring the economy back, or you can wave goodbye to this airline industry.
And I'm Leslie Marshall. I've got the final word on the Fox News Rundown.
This week, the governors of New York, New Jersey, Connecticut, Pennsylvania, Rhode Island, and Delaware said they would work together on how to reopen their shops and schools. California's governor said working with Washington and Oregon, they would look at their own plans to reopen. And on Tuesday, Governor Gavin Newsom said it wasn't going to be based around dates.
There's no light switch here. I would argue it's more like a dimmer.
He said a number of key things need to happen first.
The most important framework is our capacity to expand our testing, to appropriately address the tracing and tracking of individuals, the isolation and the quarantine.
We'd also need to have enough therapeutic drugs on hand, and hospitals would have to assure health officials that they had enough personal protective gear and ventilators in case there were to be a surge. But Newsom said even when we do go back to some kind of life where business and restaurants are open, your waiter may be wearing a mask and gloves.
Dinner where the menu is disposable, where the tables, half of the tables in that restaurant no longer appear, where your temperature is checked before you walk in to the establishment. These are likely scenarios.
He said schools may rethink how they hold classes, how students eat in cafeterias and participate in sports. Many of us may end up wearing face coverings for a while. And Governor Newsom says all of this really may be necessary until there's a vaccine. The thing is, there's no when. When is this over? And that's frustrating.
I think we need to focus not so much on the when to reopen, but on the what we all need to do so that when we do reopen, we can do so as soon and as safely as possible.
Dr. Thomas Frieden is the CEO of Resolve to Save Lives, and he's also the former director of the CDC.
And there are things we can do to make it more likely that as we reopen, we limit the kind of second wave that we may face.
Get a little bit more specific with me. What in your mind does that look like? Is that, hey, let's not tie this to a date, but let's all wear masks and do 6 feet of social distancing until like the end of summer?
I think we have to look at a few different things. One of them is, how extensively is the virus spreading in each community? And I do think we need to handle this differently in different communities, recognizing at the same time that we're also connected and people travel. So there is a real need for there to be a national consistency in the approach that's taken. But looking at how much the virus is spreading, how safe we can keep our healthcare workers, and how effectively our public health system can box the virus in. Box it in, to me, is the key concept. 4 corners of a box: widespread testing, effective isolation, complete contact tracing, and quarantine of contacts. If you can do those 4 things well, you can keep the virus in the box instead of keeping the rest of us in the box.
It sounds like China makes the case that they put this virus in a box, but there's still a lot of skepticism about their initial numbers. Where are you on believing China and their numbers and whether or not they successfully eventually put the virus in a box?
Whatever you believe about their initial response and their public statements, there is one thing that we really need to learn from China, which is they have essentially controlled this. And not everything they've done will be applicable here in the U.S., but if we don't learn that lesson, we will fail in controlling it.
Doctor, as you know, we're now doing serological testing in some areas of the country, including here in California. That's the blood draw to see if people have antibodies developed to this virus. There's this belief in California, for example, that we all had it already, and that's why our count is lower than some other places like New York's. I'm doubtful. I'm not a scientist, but I'm doubtful of this because if that were the case, wouldn't we have also had so many more deaths from some unexplained pneumonia-type illness in January and February if we were all walking around with this virus in the winter?
Yes, you're exactly right. I think one of the things that we're learning is that certain people are much less likely to get severely ill. Children are less likely to get severely ill. Women appear to be less likely to be severely ill than men with this virus, although still it can be quite deadly for anyone who is infected. When we think about serology testing or a blood test to see if we have antibodies, there's still a lot we don't know. We don't know what proportion of people have been infected yet, but those tests will help us. We don't know whether antibodies will protect against a future infection, and if so, for how long. We're hopeful that antibodies are protective, but those studies haven't been done yet. And our best estimates, based on the epidemiology, are that a very low proportion of the country has been infected so far. And that means that the virus essentially has an open field run, that if we're not careful, when we come out again, we could see massive spread.
I want to talk about moving forward briefly in terms of roles and responsibilities, because the president says the federal government is a backup for the states. On April 12th, he tweeted that governors need to gear up with more face masks and get your state's testing programs perfected. Should states have a more robust role in preparing themselves for disasters and emergencies, or did they already? Like you ran the CDC for years. What is the role of states, and does it need to shift now moving forward?
Under the U.S. Constitution, health is primarily a state affair, and yet the federal government has certain essential functions of setting guidelines, setting criteria, promoting consistency in approaches across areas. This is something that's really quite important, because what we're going to see going forward, I'm afraid, is that some parts of the country and some parts of the world that don't do a good job controlling this are going to see the places that have controlled it say, hey, we don't want you coming here, or if you come here, we need you to quarantine for 14 days when you first come here. That's something that's almost inconceivable to see that implemented in the U.S. And yet, if you look around the world, more and more countries are doing something like that. If they've gone through immense effort to control COVID in their country, and then they see people coming in and spreading it, or even people from one part of the country coming into another part of the country and spreading it, it's going to be a problem. So we're all in this together. We need the federal government to set clear guidance, and we need the states, cities, and localities to lead the local implementation of that guidance.
People seem, Doctor, hyper-focused on the president's desire to open the country back up in, whenever he wants to. I know it's fluid, it changes, it's not like one specific date or one specific region, but as the president himself has said, that it's up to him. But if the governors are the ones that implemented the stay-at-home orders, and you just said that health really is under states' jurisdiction, is this a matter for the states to decide how they ramp back up and when?
I think the best approach is going to be focusing on the data, not on the date, and setting criteria for gradually and safely reopening, and then indicating to a state or a city or a locality that if they get these things done, then this is how they can reopen. And if the federal government establishes the principles that are evidence-based for that, based on advice from the Centers for Disease Control and Prevention, we'll have the highest likelihood of being able to open as soon and safely as possible.
You ran the CDC for years. I have to get your thoughts more on the WHO and China. I know you said you don't want to look back, you want to look forward, but in order to really look forward, maybe not in the immediate future, but in the long-term future, we do need to have a World Health Organization we can trust. And if diseases are coming out of China, or in this case, as one did. How concerned are you or troubled are you about what happened with the WHO, the ignoring of Taiwan, their warnings that there was human-to-human transmission, telling us that this was that the evidence wasn't as severe in mid-January? I mean, when you look back right now, what is your advice for China, the WHO, and us moving forward?
It's really important that we work with WHO and also that we strengthen WHO. If you look at the way WHO is structured, it is limited because of the structure that it has to live within. Decisions have to be made with every single country in the world agreeing on them. Key staff are appointed based on votes from the countries that are around them. Their actual authority is extremely limited. So in my view, WHO has done well in terms of their guidance document, in terms of communicating. From the time that it was clear that this was spreading widely, they've been sounding the alarm globally. They've been open to getting input and advice. I'm sure in any organization's actions, you can look back and say you would have done this or that differently. But going forward, I think we have to look more broadly at, in terms of global health, what do we as a world need for WHO and other entities to be able to sound alarms, respond to alarms, and prevent the kind of deadly epidemics that are not only happening now, but inevitably going to happen in the future.
But doesn't an organization like WHO then need to have some skepticism toward communist or authoritarian regimes and say, well, we'd love to believe you, China or XYZ country, but we can't. You guys don't operate with a level of transparency that, a European country does or a United States does.
My first day of medical school, the dean told us, don't believe anything you hear and only half of what you see. And I think in public health, we would be well advised to take that kind of skepticism to heart and recognize that things are not always what they seem in any country. And we need concrete data, on-the-ground information, and objective assessment of situations so that we can do the protection that we need.
Well, Dr. Tom Frieden, thank you so much for your time. I appreciate it.
Thank you very much.
This is Leslie Marshall with your Fox News commentary coming up.
This era of being socially distant, staying at home, has affected everyone and every industry, especially one no longer flying high.
The airline business has been hit very hard.
So hard, the $2 trillion economic stimulus bill President Trump signed includes up to $60 billion to keep the industry from being grounded completely. How bad is it? In recent days, the number of passengers screened by the TSA is down 96% from this time last year. Many airlines have cut their service by 80% or more. Fox Business Network's Jeff Flock saw the fallout firsthand.
I am standing outside a back fence at O'Hare Airport in Chicago where I see a dozen United Airlines 777 aircraft all stacked up and parked, part of 10,000 planes worldwide, according to the International Air Transport Association, that have been completely idled as a result of the coronavirus outbreak.
So with fewer planes in the sky, many of them nearly empty, and with most Americans ordered to stay home, fearful of being near anyone, let alone elbow to elbow with a stranger on a flight, the industry is in trouble.
Oh, it's disastrous. I mean, suddenly it's like having a business and there's no business. I mean, there's nobody who wants to use your services.
Michael Boyd has been in the industry for decades, and he presides over his own aviation forecasting and consulting firm, Boyd Group International.
One airline says they're losing $100 million a day. So either we get up out of our caves and start to bring the economy back, or you can wave goodbye to this airline industry.
You said an airline is losing $100 million a day. Which airline was that?
That was That was American. Delta said they were losing 60 million. So I mean, so I mean, this stuff about why should they fly? This stuff, you have to fly everywhere you flew before. Why? You take a grant from the government, you're going to fly empty airplanes? That's stupid. They need to shut down, conserve their cash, come back up bare bones, and try to grow back with the economy.
Okay, so you think the entire industry should shut down?
Should shut down and reorganize. Right now, they're not carrying anybody. Why would you fly? The stuff about, oh my God, you're gonna cut Myrtle Beach off from the world. No, we're not. You know, the fact of the matter is, there's nobody at those gates anyway.
All right. So how do you shut down the commercial airline business?
Well, we've got a good jump on it right now with a couple thousand planes parked. So no, you just sit down and say, in 7 days we're going to come back. Instead of having 8 flights a day from Dallas to Chicago, we're going to have 3, and it's going to be small airplanes. So you just restructure it. Now, for me to sit here on the phone from Moose Mountain in Colorado, that's easy for me to say that. It's very hard for Doug Parker at American Airlines, the CEO, to make it happen. But we're going to have to do something. We can't keep operating the way we are.
We mentioned earlier the federal government's financial aid to the airlines. Well, the details were ironed out on Tuesday afternoon, and right after that, the president said,
"This agreement will fully support airline industry workers, preserve the vital role airlines play in our economy, and protect taxpayers. Our airlines are now in good shape."
Now, all the major carriers agreed to take loans and grants. Half the funds will go to keeping up payrolls through September 30th, though there have already been tens of thousands of workers furloughed. And there's something Michael Boyd doesn't like.
Well, the problem is it's money to pay employees. That's really great. And it's predicated upon you have to get a waiver not to fly somewhere. So the intent was, we'll pay employees and you can keep flying empty airplanes all around the country. I don't think it's going to work at all.
Go into more detail what you mean by that, because I'm not exactly sure what a waiver not to fly.
Oh, well, here's the deal. The idea is, on paper, if you accept these grants and these loans,
right,
you are required to keep flying to everywhere you flew on March 1. Now, whoever dreamed that up is a moron, because you're telling an airline that you'll have to keep flying to places that have no passengers. They still think, if you don't fly to Wichita, it's going to die. The fact is, there's no passengers in Wichita. So airlines are allowed to go to the Department of Transportation and say, I need a waiver to not fly to the following cities. So far, they've applied for about 126 cities, or actually airports not to fly to. There should be more than that. But the fact of the matter is, why would you make an airline fly to places where there's no passengers?
And then they don't really seem to match because the airlines want the money.
Yeah, well, airlines need the money. There's no question about it. But the fact is, telling the airlines, if you take the money, you got to keep flying and losing more money, because the money is only for employee salaries and benefits. It doesn't cover fuel. It doesn't cover maintenance costs. Doesn't cover the overhead for the airplane. Doesn't cover lease costs. Anything like that. So it covers part of it, but not all of it. So you might be losing $100 million a day. Well, now I'm going to only be losing 60. Big deal.
So it's more cost effective to say no to the government's money and just shut down.
That would be my opinion. Either that or, just shut down and readjust your system. But it's a real deal with the devil to say, if I take your money, I have to keep flying to places where everything is empty because idiots in Congress think that there's passengers there.
Let's talk about the aircraft itself and what you think could be done to make it better for social distancing. Do you have to have every other row? Do you have to have every other seat? Do you have to have plastic up between rows? What can be done?
Well, any of those things, and you brought up a good point. You can't get on an airplane without being in proximity to somebody. I mean, you can't say we're going to march people down 6 feet, 6 feet, 6 feet, 6 feet. You'll never get the airplane boarded.
It'll take an hour at least, right?
And they said, well, we'll only sit every other row. Fine, won't make any money then. So, and besides that, when you get off the airplane, don't get up to overhead because the guy in front of you is getting his bag out. We've got to find a way to sanitize airplanes. And sanitize, the air is already sanitized in modern airplanes, but things that get touched, how do we work that out? And how do we make sure that every time someone gets off the airplane is sanitized? That, I think, can be done, but we have to focus on doing that rather than just simply saying, well, we'll wait till the virus goes away. Hey, listen, it's coming back in China right now. It never was cured in China. So China's starting it all over again. So it could come back again. We may be with this. So we either let this kill us physically or economically, or we do something different.
Let's get a pilot's perspective now on how to make a plane safer to be on in this corona nightmare. Rob Mark is a commercial pilot and a blogger at jetwine.com, and that's wine with an H.
I think it's going to be very difficult for the airlines to get going again and put people in a small space and not require something like a mask for some period of time when you're sitting 2 or 3 inches away from somebody. I don't understand. I guess I don't think anybody really knows how we're going to cope with that kind of situation. It is actually rather unique. Us and maybe a movie house. When those get back on, how are we going to put people closer together again? But I think it's going to be quite a while before we hear a flight attendant get on the PA and say, "Well, we're expecting a full flight today." That's going to be a ways away.
If you have every other row or every other seat, how do airlines make money?
Well, see, that's the problem, is that they've kind of made a business out of jamming lots of bodies in lots of seats, and but let's not feel too badly for the airlines. I mean, they've had a record decade of billions of dollars in profits, and that was certainly a turnaround from where it used to be when you heard that they only lost X million or 100 million per year. But I mean, that all started when they realized they could start charging us for bags and to pick seats and to climb on the airplane ahead of somebody else. And they realized that was just a bonanza for them, and so they've made a lot of money. And honestly, too, we have to admit, the airlines spent a lot. Airlines and even companies like Boeing spent a lot of money buying their shares back to keep those dividends going to their shareholders. And I don't think they were real worried about passengers. And now it's a different story, and they're saying, "Oh my gosh, you've got to help us, or we're going to go broke." And we don't want that either.
How do you have workforce not be cut back in the coming months with hardly any flights? We're talking not just pilots, but you're talking flight attendants, you're talking about people who do maintenance, you're talking about the baggage crews. How do you do it?
You don't. You're basically putting their salaries on a credit card, and you're saying that come after Labor Day, those few weeks before the end of September, when these restrictions are supposed to wind down, that's when it's going to get really interesting because they're going to be able to lay people off. And I think we're going to see, unless there is some major nudge to get the system back going, and I think the airlines certainly will be pushing hard to get the system back running as close to normal as possible, because they don't want to lay people off. They really don't. Maybe a few, but they really don't, because they want to get back to where they were, making a lot of money. And I mean, let's face it, that's capitalism. That's how we operate.
Of course, with very few people traveling and airport stores closed, it's affecting nearly everyone who works there. And the local community's not getting tax revenues. Another issue, all those planes sitting idle, the longer they don't fly, the longer it will take to get them ready to.
It's not like a car where you say, okay, let's get 609 on the line here and we'll take it on the next trip and, here are the keys and start it up and go over there. It doesn't work like that. Airplanes need maintenance when they've been sitting for a long time. So you multiply the number of maintenance technicians around to get the airplanes going by the hundreds and hundreds of airplanes that may need to get going, and that alone is going to be a mess. And we were talking about that just with the 737 MAX issue a few months ago.
With Boeing, right? Yeah.
Yeah, when that got back together, they were still going to have to get those airplanes flying. So now we've probably increased the number of airplanes sitting around tenfold all over the world. But now it is quiet all the time. And we know inside this isn't coming back right away. I mean, we don't know where the end date is.
Thank you to Rob Mark for his insight. And his last thought is something people questioned nearly 20 years ago, when airlines were grounded after the hijacked planes were used in the 9/11 terror attacks. Back to Michael Boyd, who says this coronavirus threat is not the same.
Everything is different. At 9/11, it was fear of somebody blowing up your airplane. Here, it's a very real situation where, if you bump into somebody at the frozen food counter at the grocery store, you're going to get a disease, let alone on an airplane. So right now, the difference is then we had demand. Here we have no demand. The demand has been evaporated.
Well, I did fly in late September 2001, and I went to San Francisco from Boston, and there were about 7 people on the plane. So there were people fearful at the time of getting on an airplane, just like we have now. How long did it come back in 2001 where people were like, okay, I think I'm good with this?
It took a couple of years to get back to that demand. A bigger hit was the 2008 recession. I mean, even today we're flying fewer airplanes now than we were in 2007. So, I mean, there are hits that hit, but they're not as fundamental as telling people you have to stay at home. You can't go to the airport even if you wanted to. And if you go to the airport, you might get a dread disease that might give you a stomachache or might kill you.
Michael Boyd, thank you very much for joining us.
My pleasure, sir. You have a good day.
You too. Thanks, Michael. Much appreciated. Thank you.
All right. Bye-bye.
All right. Take care.
It's the latest from Fox News Podcasts, The Campaign with Bret Baier, with updates from reporters on the trail and in-studio experts. Bret keeps you informed on the 2020 race. Go to foxnewspodcast.com and download The Campaign with Bret Baier now. Rate and review the Fox News Rundown on Apple Podcasts or wherever you listen.
It's time for your Fox News commentary.
Leslie Marshall.
What's on your mind?
Senator Bernie Sanders acted in the best interest of the Democratic Party and the nation when he dropped out of the race for the Democratic presidential nomination. But now he's gone one step further in acting in the best interest of the Democratic Party and the nation by endorsing former Vice President Joe Biden for Democratic nominee to run against Donald Trump in the upcoming election in November 2020. In addition, former President Barack Obama has also weighed in and added his endorsement of the former vice president for that Democratic presidential nomination. So now that Joe Biden is the presumptive Democratic presidential nominee, what should he do going forward to make Donald Trump a one-term president? 1, be more visible. Biden is doing weekly podcasts and posting those online and giving media interviews. But his team needs to be more aggressively seeking out as many media interviews as possible to keep him in the news so he doesn't become an invisible man. He needs to hold regular news conferences to compete with Trump's daily White House press briefings. He also should partner with Sanders. Unfortunately, Sanders said he was going to remain on the primary ballots to get convention delegate support in order to influence the Democratic Party platform and direction. But Biden needs to reach out to Bernie and to the greatest extent to his supporters to form a team and to end their rivalry. The endorsement by Sanders of Biden is the first step in the right direction to do that. Now, Trump has appealed to the supporters of Sanders, however, for their votes. Biden needs more than just Sanders' endorsement. He needs Sanders to explain to his supporters, the Bernie or bust folks, those diehard supporters, that while Sanders and Biden have their differences, those differences are minor compared with the enormous differences between Sanders and Donald Trump. Something else Biden needs to do is to unify Democrats and appeal to swing voters. He needs to do more than build an alliance with Bernie Sanders. The former vice president needs to appeal to all Democratic factions and also to independents and to Republicans who dislike Trump for any number of reasons. Capturing a good chunk of these swing voters is crucial to put Biden in the White House. Biden is already committed to selecting a woman as his vice presidential running mate. That's a smart move. He needs to give serious consideration to picking a minority woman to boost his support among minority voters, although he already enjoys far more minority support than Trump. Biden also needs to remind voters what's at stake in the election. If Trump stays in office and gets to appoint one or more Supreme Court justices, the High Court could turn back the clock on many progressive victories involving abortion rights, health care, civil rights, immigrant rights, and other issues. In addition, Trump has shown he is committed to cutting taxes for the richest Americans and cutting programs that help the poorest Americans, the middle class, and minorities. Biden needs to get millions of more voters to understand that voting for him is in their own self-interest. We face a strange election campaign in the months ahead, limited for as long as the coronavirus limits gatherings and dominates the news. But the bottom line is that now that Bernie Sanders has withdrawn from the race and supported Joe Biden by endorsing him for president, it allows the former vice president to focus now on Trump instead of on his rivals. And that's good news for everyone who wants to see a Democrat in the White House in 2021. I'm Leslie Marshall.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust, and click the Fox News Rundown playlist for the latest episodes.